Some of the biggest advances in breast cancer surgery have to do with surgery for the axillary lymph nodes. So the axillary lymph nodes or lymph nodes in the underarm are the first place that a cancer will go to if it's going to spread outside of the breast. And to this point in time, none of our imaging studies are as accurate as we need to be in order to detect spread, so we still need to do surgery. And the biggest complication, the most dreaded complication from lymph node surgery is lymphedema or arm swelling that can be permanent. About 20 years ago, a technique called the sentinel lymph node biopsy became standard of care. The sentinel lymph nodes are the first lymph nodes that drain the breast, and so if we can find the sentinel lymph nodes and there's no cancer in them, then the chances of any other lymph nodes having cancer or it being anywhere else in the body are very, very small. And so by removing very few lymph nodes in order to detect spread, we're able to decrease the risk of lymphedema or other problems such as nerve injuries. But over the last several years, we've been able to increase the number of patients who are also candidates for this less invasive surgery, particularly patients who are going to be treated with chemotherapy prior to surgery. And we've also been able to decrease the number of patients who need to have more lymph nodes involved if there is cancer found in the sentinel nodes. And so we're able to decrease the percentage of patients who will develop lymphedema, but we've also started a lymphedema prevention program where we're able to monitor patients for the development of lymphedema. So any patient who's going to have lymph node surgery is able to be measured with a non-invasive device called a SOZO that uses bioimpedance to measure body fluid, and then we can follow them periodically after surgery. The idea being that this machine can detect very small increases in body fluid, maybe before there's even swelling or any other symptoms, and then they can be evaluated by our lymphedema therapists and avoid the progression to chronic lymphedema.